Hi, and welcome to another edition of Diabetes in a Minute. Today we're going to be talking about numbers. Now I know that that doesn't sound like an exceptionally exciting topic, but it is through numbers that you can determine if in fact you have prediabetes or type 2 diabetes, or if you don't have a glucose impairment. The answer doesn't come from the number that you might get on self-monitoring. So if your mom has a meter or your grandfather has a meter, don't test your blood sugar and panic if you have a high reading. We always diagnose diabetes with a venous blood sample, which means you go to the lab and have your blood drawn. Ideally, you're going to have your blood drawn fasting. And in most labs, that means that after midnight, the evening before the blood is drawn, you don't have anything to eat or drink until your blood sample is taken. Most labs allow for 8 hours or more to be considered a fasting reading. So in general, you can eat before midnight, and then I like to schedule my lab tests somewhere around 8 or 9 a.m. so that I can get the blood drawn and get on with a normal day. You are allowed to have water before most lab tests, so it's just no food or anything to drink except for water. When those labs come back, they're going to come back to your physician's office. I always make sure that when I go to my doctor's appointment, I bring a stamped self-addressed envelope with me, and I leave it with my chart. And then when my lab values are returned to the doctor, a copy can be made and sent to my home. I keep a file of my labs. I want to see what my progress is. I want to have the numbers, in my possession. I don't want a phone call from the doctor's office that says, sometimes on an answering machine, everything looks great, we'll see you in 6 months. That doesn't work. You really want to have a sit down with your physician when your labs come back, and you want to go over point by point what the story is. And the reason I say this is, in my practice, I have a private practice in medical nutrition therapy. I never see a patient without first seeing their lab work. I have to know what's going on inside the body so that I can help treat that person with diet and activity. And so very often I was the person telling my patient that they had prediabetes or diabetes based on that lab test. It shouldn't be coming from me. It should be coming from the physician. But their physician's office cleared them and told them everything was fine. So it's a real good idea to make sure that someone looks at those labs with you and goes over them. When it comes to glucose, you look at fasting glucose. If the number on your result is between 65 and 99 milligrams per deciliter, that is considered normal fasting blood glucose. So someone with no prediabetes or diabetes will have a number between 65 and 99. If your fasting reading is 100 to 125 milligrams per deciliter, you do not have diabetes, you have a diagnosis of prediabetes, which is a blessing because it means you're not yet diabetic, you're getting there, but you have a chance to make diet and activity changes, lifestyle changes, to possibly prevent becoming diabetic. And then a blood glucose of 126 or higher on fasting blood sugar is considered to be a diagnosis of type 2 diabetes. You do want to have 2 different readings confirm that you have diabetes. So should you get a test back and it comes back at 134, and that is diagnostic on that one lab test of diabetes, you would go back on another morning and repeat the test because you would want to have 2 separate lab tests on separate days show that you have a diagnosis of type 2 diabetes. It's just a clarification, make sure that there wasn't an error. Recently, some doctors have been using a test called hemoglobin A1C to diagnose diabetes. A hemoglobin A1C, that's A like apple, the number 1, and the letter C, is an average blood sugar result that looks back in time. So from the day you have that blood drawn, it goes back about 3 months and 24 hours a day, 7 days a week. It gives you your average blood sugar reading. And if your hemoglobin A1C comes back between 5.3-ish and 5.6, that's considered to be normal hemoglobin A1C, normal fasting blood sugar. If it comes back 5.7 to 6.4, that would be diagnostic of prediabetes. And a hemoglobin A1C of 6.5 and higher is diagnostic of type 2 diabetes. Now, if I did get an A1C of, say, 7.0, which would be diabetes, I would have a repeat test done of a fasting blood sugar on another day and see if that also comes up in the range for type 2 diabetes. So you see, the numbers are important. There are years that pass between prediabetes and type 2 diabetes, and they're very valuable years because during that time you can do something to reverse your situation. But if you're pre-diabetic and your physician's office is telling you everything is fine and doesn't alert you to that fact, one day you're going to be receiving a phone call that says you better come in and see the doctor, and when you get there you'll be informed that you have a diagnosis of diabetes. Type 2 diabetes is correctable, it is controllable, but it is not reversible. It's not, despite how terrific you keep your blood sugar, once you're diabetic type 2, you will always have diabetes. So I basically have the blood sugar of someone with no diabetes, and I don't currently need medications to remain with normal readings. But if I were to eat a bagel right now, or if I were to drink a regular cola, regular soda, and you checked my blood sugar a couple hours later, that reading would be sky high. See, I keep my blood sugar in the normal range. I keep type 2 diabetes controlled. I won't have any long-term complications if my blood sugar is always normal, but I will always have type 2 diabetes. So that's the story of the numbers as they relate to diagnosis of prediabetes and diabetes. And I hope it was helpful for you. We'll see you next time on Diabetes in a Minute. Bye.